Hello, Dr. James Bogash, expert in health and longevity, and in today's video, we're going to talk about a study that should come as no surprise, and it's linking antibiotic use in labor with a pretty strongly increased risk of autoimmune diseases in the infant. I cannot stress how important it is to have a good, healthy bacterial flora in infants, and we set the stage for the immune system in the first 2 years, really. So anything that disrupts that's going to change the trajectory of the immune system for the rest of that child's life. Before I go into more detail, make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel. So back to this, we know that antibiotic use drastically increases the risk of things like Crohn's disease and Crohn's and ulcerative colitis, because you are, during development, kind of picture it as the immune system and the gut flora growing up together, like a infant and a puppy growing up together, and now this great big dog is all friends with the infant or the toddler now, because they grew up together. That's the way the immune system and the gut is designed to develop. But when we introduce antibiotics, we completely screw up that balance, and the immune system doesn't really know what to do, and it can set up an autoimmunity. So it goes without saying that we use antibiotics. It's something like 90% of kids by the time they're 2 have had at least one course of antibiotics. Just ridiculous. Now, there are times when it becomes relatively important. In this case, we were looking at this study looking at 45,000, almost 45,000 and a half vaginal birth deliveries. C-section are in a different category. And it was looking for women who had Group B Strep. Now, you don't necessarily want to have your newborn infant be exposed to Group B stress, because that's not good for the infant. And there are a surprising number of women that are positive for Group B Strep, and so the typical action is to give antibiotics during labor to prevent the transmission to the infant. In this particular case, 21% of the deliveries got antibiotics. So again, like I said, it's a pretty high percentage. And what they found is that of those 600 infants developed autoimmune conditions, and they found that those who had antibiotics were 28% more likely to develop these autoimmune conditions. Highest on the list was celiac disease. So you look at our culture and how many people are now sensitive to gluten that may have started with antibiotic use in the womb. That doesn't mean it's genetic. It means it's environmental, and the infant's microbiome got blasted before it was ready to develop. Type 1 diabetes. Yes, type 1 diabetes is an autoimmune condition, and there is a lot of things like antibiotics and vitamin D exposure that can change the trajectory about whether or not an infant's going to develop that, or toddler, and rheumatoid arthritis. So 3 big autoimmune conditions. What that means is that if somebody's got Group B Strep, maybe it's not the time to discuss antibiotics or not, but what we can't do is give those antibiotics and just go about our merry-old way and think that everything's going to be okay, when we have seen again and again that antibiotics are linked to autoimmune conditions in infants and toddlers. So that means that nursing becomes important, because that helps build a healthy bacterial flora. Avoiding antibiotics in the future, if possible, unless it's a life-threatening emergency. Different, possibly probiotics, both for the mom and for the newborn. You just need to accept that the risk is going to be there, and we need to do everything we can to help rebuild that microbiome. And it just means that it's that much more critical to develop a healthy gut microbiome in an infant if they were exposed to antibiotics during birth. So As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.